Judge, just want you to know y'all muted in there. That's better.
I know you won't. Yeah, where are we at? We're here. Downstairs. No, you're good. Krista should be coming in online. Yeah. Oh, she's online. She should be. Where are you at?
He's not logged in yet, sir.
Oh, around here. Oh, yeah, you got that. You're my daddy. You got that big winter coming.
Squire, I've got 2:30 whenever you're ready to start. We're live and it's time.
Okay, we're gonna need Krista. Yeah. To log on. I'm texting her now.
He's logging in just now as we speak. I assume that's her. Yes, that's her.
We are. Okay, Jeff Botts, Administrative and Budget Committee of Barron County Fiscal Court will have a meeting on Friday, December 17th, 2021, 2:30 p.m. in the Barron County Government Center Fiscal Courtroom, 117 North Public Square, Suite 3A, Glasgow, Kentucky, to consider the following agenda. And I do call this meeting to order. I'm Jeff Botts. Mark Bowman is here present. Billy Houchins is on our committee. We were asked to have this committee meeting just to discuss American Rescue Plan Act's funds. And I'm going to go ahead and turn it over to the judge and let him speak. Okay, Tim, can you hear us okay?
Yes.
Okay, perfect. So, Court, what I want to address with you today, and I've been able to meet with some healthcare folks throughout our committee. Matter of fact, Magistrate Bowman went with me to a meeting last week to speak to some leaders of our healthcare. With what we've been through with COVID and what's still coming with COVID, we have been affected healthcare wise, I believe, worse than we think. And when we met with the leaders last week, I believe, and I've asked Neil Thornberry, the CEO, TJ Sampson, to come and speak today, along with LaDonna Rogers. The one question that I asked, and I think this kind of puts it in perspective, has our healthcare system failed us yet? And I'm going to let him answer that. But I do know, in talking to some of our long-term care facilities, they're having to close wings now because they don't have the staff. And when you think about that, there's waiting lists for people to get in for long-term health care, but they don't have the staff to take care of it. So these folks, our residents, are having to go somewhere else in order to actually get into a nursing home, which that's really sad. It really is. And then with all the openings that TJ Sampson has currently, they're fighting the contract workers and trying to keep people. With this, these funds for the American Rescue Act, that's what these things are designed for, is to help with things like this. Our community, I knew we've been affected, but after sitting and talking to some of those nurses on how bad we have been affected, I challenge all of you to go talk to them, because it was pretty eye-opening to me. I thought I knew until I sat down and talked to them. And then now to learn that they're actually closing wings of these healthcare facilities because they can't staff them. Guys, that's unacceptable. It's truly unacceptable. And, we have the tools that I feel to help that. And, this money is sent down to
to help rebuild our communities. It's not meant to sit on it. It's meant to get it out here in our communities and make differences. And when you look through this, and I've got the whole package, and this is from the Department of Treasury, final rule. It talks about staffing in nursing homes, hospitals, and home care settings, public health and safety staff. You know, those are things that's listed here that we can help out with these funds. But what I want you to do, what I want to challenge you to do, is ask Mr. Thornberry some questions and Ms. Rogers, you know, how it's affecting their operation and see where they're at. But again, I do challenge you to sit down with some of these nurses that have had to deal with the slow death this COVID has caused in our own residents here in our community. You know, being personally affected by losing an aunt and a cousin to COVID. I can't imagine. I know we didn't get to see them in their final moments, but it's pretty eye-opening. It really is. So I'd like to ask Neil or Ladon, either one, to come up first. And, you know, guys, just explain to these folks, and obviously we'll take this to full court and talk about it too, but just explain to them, you know, how this has affected your operation. You know, obviously the folks that you have on the ground, your care has not dwindled off. You're still receiving care. You just don't have enough boots on the ground. And you know, here's another thing they probably don't know, that the office staff is having to go help with patients, prone patients. You know, that means they go to these units and they help turn these COVID patients physically because they don't have enough help. So I think that's something else that we didn't know in the community. So anyway, Neil, if you want to come on up, and we have Master Coomer, he's joining us virtually. So
I'll just talk at a high level and then be glad to field questions. But what the judge said is exactly right. It's a very precarious situation in healthcare, especially, and I can speak from the hospital standpoint, but I'll give a good example of what you just talked about. This week in the hospital, we are in what we would not consider the third surge. The first surge for us was back in the fall of last year. That's when our community was really hit with it, and the hospital was hit with it. And what we've seen out of that first surge was, again, you're used to seeing people that are taking care of folks that are normally, most of those people are discharging home. Now we are taking care of folks where a large percentage of those people are dying in our hospital. So the stress that brings on the workers, it's just a very different type of stress. So what we saw for the first surge is we depleted quite a bit of our nursing staff out of our hospital just through sheer just stress and from their standpoint, fatigue, really just compassion fatigue and fatigue in general. Many of those people got out of healthcare. Many of them took a step back. Many of them started to be contract workers, working small stints. So for us, it was a staffing issue. Then we saw the second surge this fall. So in the months of August and September, we had a significant surge, even more so than the first one last year. And what we saw in October of this year is, again, we depleted a large number of our nursing team, as well as others that impact that care, respiratory, lab, any of those folks that are on giving hands-on to those people. We attrition those people out of our system for various reasons. As a result of that, we've had to go out into the contract setting and try to negotiate contract rates and get contract nurses from around the country to come into our hospital. The challenge with that is every other hospital is fighting the same thing I'm fighting. As a result of that, the contract companies have now tripled their price. So again, for 10 contract workers in an 80-hour pay period, it's costing our organization about $250,000 a pay period. So that's for 10 people coming in. So it's a significant cost that is not sustainable for us. Again, back to what the judge was saying, this week we had a very full hospital. We are not in what we would consider a full surge, but we are in the 20s with our census. We had about 17 people holding in the emergency room. So we had 17 people come in that needed to be admitted to the floors. We could not admit them to the floors. One of the issues was we couldn't discharge patients that needed to go to long-term care facilities because there are no long-term care beds because they don't have the staff for those beds. So we're trying to get beds in Columbia, in Elizabethtown, in Owensboro, anywhere we can place patients. Of course, that's almost nearly impossible to do because they're facing the crisis like we are. And the challenge in that, a lot of patients that need to be admitted to the hospital, again, the care that we're providing is good quality care, but it's sometimes not in the right place because some of those patients in the emergency room that are holding end up having to stay down there 2 or 3 days and discharging home from our ER, which should never happen. But the challenge of that is we don't have the staffing to be able to keep up with the numbers. We can't really transfer those patients out because every other hospital is facing a similar situation we are. And in having conversations with the regional hospitals, talk about even the Bowling Green hospitals, they're now over 100. They have now over 100 contract staff working in their hospital, which again, I don't know how they're sustaining that financially. But it's a very precarious situation, and we're very fearful of the next wave, which we know is going to come, whether that's through the Delta, Omicron, but we're right now on the cusp of another significant surge for our hospital with very depleted workforce. So we are in a retention game. We're trying to do every single thing we can to retain these people to stay in the community to work. And it's almost impossible because now we're asking them to work more extra days. And the people we're bringing in don't have necessarily the same values of people in our community. So it's hard to keep those people accountable that come in and take care of the families, which we do. So it is a challenge. I would say that we are hopeful that this subsides and that we're able to recover. We don't foresee that within the next 12 months. Unfortunately, we just don't see it. So it's difficult. It's a difficult situation. I don't know if you fill in the gaps there.
I always have one.
Sure.
Okay, the thing that might, this come down anymore, for short people. Okay, all right. The things that, Michael, I appreciate everything that you said, but a couple of things that I would like to add to that is that since January 1 of this year, we have lost 166 employees. And that comes out to a 20% turnover rate. Pre-pandemic, we had 11% turnover rate. So you can imagine, I'm in human resources, I'm the vice president of human resources, and that's devastating to me. Mostly because our hospital is a hospital full of families. Those are people that everybody you walk down the hall with, you know, and everybody they're taking care of, you know, and that's why the care hasn't changed. And, you know, the thing that I found that they would like more than anything is to be recognized that people know how hard we're working. You know, they're out there with those 17, 20, 25 COVID patients a day. And then they come out in the world and everybody seems to think it's over, and it's not over. When Neil said it was $250,000 a pay period for 10 travelers, that's 2 pay periods in a month. So we're spending $500,000 a month in travelers. And I tell you, holding it at 10 is all we can do because we really, really need more than that. We've got close to 100 positions posted. I never thought I'd see a day when we had 100 positions posted. Trying to think what else I've left out regarding our staff. I'm very passionate about this. I have been up on the floors on days when, you know, the staff knows that everybody is in it together because you'll have a code going on and you've got the chief nursing officer and the vice president of patient care services in the room doing the code because the nurses are too busy doing something else with another COVID patient. You've been in the ICU and you'll see a nurse come out of a COVID room with all the garb on that you see on television, and she's wiping tears off of her face before she goes in the very next room. The things that you see on television every night are happening at 1301 North Ray Street. And no, the care hasn't changed because they're committed to our community. And Neil's right. When we bring in travelers, those people have no ownership to us. They fill a spot. and they're making double what the nurse that lives here is making. So anything that you all can do to help them, we would so appreciate, because we're struggling every day to keep our people there, and they're tired. And, you know, there's nurses just waiting to retire. And, you know, when I see those numbers go up, I think, you know, oh, I feel so bad about the people that are sick. But I know that the people that are taking care of them are worn completely out. And they're thinking, oh no, we have to do this again. So anything you all can do to help us would be just amazing. Thank you.
I have a question for either one of you all. I wasn't able or didn't go to the meeting with Mark, but one of these, the money, like if we come up with a magical number, whatever that number is it specifically going to be able to go to your employees, or are you all set up to where it has to go here? We just want to make sure, what are you going to go with what we give? Is it for 100% the employees or to help you in your budget?
No, it is 100% for employees.
Okay, just want to make sure, because I think something else that we looked at, that they can't, you have to give that lump sum, but they can't literally give it to the employees. I just wanted to make sure we're clear.
Their needs all over the place,
Right.
but that staff, that workforce is the most important thing in our.
So it's going to be 100%, anything the court decides on will be for the employee, the incentives for the employees.
Yes.
Okay, I just wanted
You
to
have
make
my
that.
word.
And we'll be very transparent in that process. So whatever funds you provide us, you'll know where the payroll went for to those people. Exactly that.
And trust me, the credit will all go to you.
And also, if you look, and we'll let Krista comment on this a little bit, but we'll have to have that agreement between the court and the healthcare sector of how this is specifically spent. So, and they will have to follow that agreement, or they're liable. Okay. And Krista, if you want to comment on any of that.
Yes, that is right. There are reports that the federal government will have each entity to fill out to make sure that the money is spent the way it was intended.
Okay.
And they're pretty basic. It's not anything cumbersome.
So when I think about with your healthcare being challenged like it is, and we talk about economic development, trying to recruit economic development, I don't think many companies are going to look at areas like this if your healthcare is failing. And I'm sure a lot of folks are dealing with the same thing, but I look at the long-term effects. You know, we're asking our constituents, they have to go somewhere else for long-term care. And, you know, that to me, that's not right. Especially when we're setting with the tools to help our healthcare sectors retain their employees. And again, until you sit and you talk to those folks that have watched these people pass away, you just can't get the full picture of it. You really can't.
You know, during that second surge, our hospital is accustomed to losing approximately 70 patients a year. We're a hospital where people come and typically they go home. We get them well and they go home. During that second surge, we were losing 40 patients a month. You all have any other questions for me?
Y'all have anything else for either one?
Just for the knowledge of what, I know you all got other county, you all were in, I know Columbia, how many other counties do you all represent as TJ Sampson and help, you know, that you all hospitalize or have services in besides Barron? Maybe help us know how you all extend, not just Barron County.
Seven counties.
And I know probably one question, or, you know, are we gonna look at, I know you got other employees in other counties, or I'm assuming you all probably went to other counties, maybe done, I'm just thinking of things that may come up, trying to save just a little bit of time on the next court meeting. Are we looking at employees of Barron County? I know you've got,
Yes,
You know,
we are looking at this
I'm-
money would go specifically for people that work at this hospital.
I know, just was wondering, that would probably be a question brought up that can be answered now.
Sure.
And I know that's gonna be hard. I'm assuming, some crosses the line, some
But we
employees.
would ask Adair County to help us with the Columbia Hospital.
Right.
And those that are working in that one, the hospital will not be eligible for this, obviously, so there will be people working in the organization in this county.
Are there other funds or other areas that y'all have been available for or not been available for?
Yeah, in the first year, especially in 2020, they were able to supplement a lot of the hospitals. Really, a majority of the funding was due to the shortfalls of what occurred there. And it was different across the country, but for us here, it was the first 2 months, March and April, especially into May, where they shut down all the outpatient care, which is all your physician offices, except for emergent cases. Then they also shut down all the surgeries, which for a hospital, those are probably the two biggest areas for us. For those 2 months, as we shared with the judge, it was, that's half, probably 60% of our income. So we were faced with either laying off 60% of our workforce, which would probably be upward of 700 people right in there. Thankfully, that's what that money was for, is for us. We decided not to do that. We did have employees that go out there and took voluntary.
I took voluntary leave of
Leave
absence.
of absence.
We did not have to lay anybody off.
Thankfully, we did not do that. So, yes, there have been other places where we have gone out and tried to get any type of grant money we could get to be able to support nonprofit hospitals. And we've done that. The question would be, is all the money that we've been able to procure, close the gap, or give us more than the shortfall? Not even close. It's not.
Guess one question I'd have, as far as I know, being in business too, and some of the money that was out there for regular business owners, some of our work hands took advantage of that. How big an impact do you feel like, because there was money that was basically give to people if they didn't work, impacted the employees? Do you feel like that you all had a lot that maybe took advantage because they knew they were going to get money?
At one point in time, some of our lower level employees took the voluntary leave because they were paying more, they were getting more money to stay home than they were to come to work. With the unemployment, they were getting more money, but when that dwindled, then they came back to work.
Yeah, you're talking about another. Now, we were talking about the more the medical nursing side, clinical side. There's a whole other issue out there, which is that administrative group that we've got, that is the $16, $17 to $12 worker. Again, now we're competing with a lot of other places, factories, food industry, that are now pulling from that group. And on top of that, you mentioned, again, some of the supplemental income that was provided to that group. So it's created a group that has not been so ready to come back out to the workforce again. So we've got a shortfall in that group, which has created some challenges for us. So it's a pretty interesting dynamic on both sides, really.
Neil mentioned in the meeting that we had with Mr. Wellman and the judge that being the largest employer in Barron County is not what we subscribe to be. We don't want to be the largest, but we are the largest currently. When I think Barron County, I say this, I guess selfishly, we're very, very fortunate to have a hospital the size of TJ Sampson.
Amen.
Very fortunate, because you go to other towns our size, they don't have a hospital like that. If we fail, the county, the whole county's gonna fail.
I agree with that.
Yeah, I do too. Do too.
Very well put.
Of course, I think one of my main concerns is those healthcare providers that are physically providing that care, you know, for these patients. You know, if anything, it just says, hey, thank you.
Oh, yeah.
You know,
Yeah. It's that recognition that I
yeah,
talked
if
about.
anything, it says thank you. And I think we had figured up somewhere close to about 1,800 employees in the healthcare sector in Barron County. That's about how many works in the healthcare. That's nursing homes. That's TJ Sampson. That is your Amedisys, health, home health.
Yeah.
That's everything, you know, within your community. And we also had conversations, Mark, I think you remember this, if we gave money to this, we would give to TJ for them to disperse.
Correct.
To the medical sectors, and they said that they could take care of that. But, you know, again, I know we've got some that just want to sit and wait. I don't think we can wait. I seriously don't, guys. You know, it's pretty detrimental to our community, especially if we know it's going to get worse.
I would plead that you not wait, because in 12 more months, I'm going to lose another 166 employees that I haven't been able to capture back.
Well, what is your all's, I mean, you all met with Mark, and I heard it was, the meeting was, a lot of the nurses got emotional. I wished I was there. I wished each court member could have seen that. I think that would help, you know, it kind of get in the real when you
Well,
see a nurse.
actually, I was hoping that if we come to the full court meeting, that we would bring a staff nurse with us. And I think Michael was talking about when he went to NHC.
Yeah, right.
Is when they
We
came
didn't
through,
actually-
Yeah.
it's just a bunch of talking heads.
Well, they, also their CFO.
Yes.
Correct.
Sir, that way.
Yeah.
But how many, I'm sorry,
No,
Neil.
no, I would
There's
agree.
some-
I think if you saw them, they wouldn't even have to speak.
No.
You would know, you would see it.
You sure? You're exactly right.
It's significant. It really is, what they're doing every single day. And I can speak to the nursing homes as well, because I know they're working in a similar type of environment. When you're having to, again, carve up completely, 12 hours a day, going in one room, coming out completely uncarved, because you don't want to take these germs to the next room, and then completely carve up for another 10 minutes. And sweat all day, and these masks, I tell you, these are comfortable. Putting on those N95s with straps that are so tight on you, you just have to look at them, and you can really see the work that they're doing, and you can see why they're attritioning out. It's difficult work, it really is.
And we do have staff, we do have administrative staff that are going into the rooms and proning the patients and turning them every day. John Thomas is doing that. I mean, I never thought I'd see the
Yeah.
day that John Thomas would go in a room and help prone a patient.
Did you all, I'm assuming, what's your goal of trying, I guess you've talked with the judge, so we can kind of think on this weekend, the ones that are here, of when you all would.
I've got a recommendation
Okay.
of what we need to do or
Okay.
what we should do. And, you know, whether you guys want to discuss it today, or just bring it to the full court. I'm going to ask these folks to come back.
Yeah.
To speak for sure. That, you know, I feel like this recommendation would hit all sectors. But, you know, I also want to reach out to the city of Glasgow to let them know what we're doing, because, you know, they receive their own money. And I think they need to be a part of this too, because those employees pay occupational tax to the city of Glasgow. And I feel like that, you know, that they should help out with this too. So.
Very appreciative of the healthcare field that we have in Barron County. I think, for all practical purposes, TJ is a regional healthcare facility. I mean,
We look at it that way.
there's no other way of looking at it. I mean,
Well, if you're representing Zevon County.
Right. You know, I know Warren County, you know, has a large facility, but at the same time, I think, you know, I would think Metcalf and Monroe and other counties look to us every day.
Very much.
Neil and I are striving for the day that we are so good and all those positions are filled and we have a wait list of people wanting to come to work.
Great.
One other question, is any, I know most businesses had helped with the government. Have you all been able to help any of your incentives, or I don't know what you all can do. Of course, fiscal court and our county government, you can't give bonuses or anything in ours, but this money, we were able to do that. Have you all been able to do any kind of incentives with any kind of government help already so far with any kind of funds?
Yeah,
Two.
we had a grant that, it was a grant with it. We received a grant that allowed us to give our employees a bonus at Christmas, which
Great.
is more than we've been able to do ever before.
So they were able to get, now, is that just TJ, or is this part of the group that we're looking at doing?
No, it was just.
Just
our-
Okay, because if, the way I'm understanding that, Judge, that if we, it's the 1,800 is, whenever we come up with that proposal, your proposal, they're gonna get the lump sum and then they're gonna
Yes.
spread it out.
That's correct.
Okay. So right, as of right now, we don't know any of the nursing homes workers got them.
Yeah, I don't know.
We don't know that, but we know that TJ's has.
Yeah.
Okay,
Yes.
great.
And the other thing is that the larger facilities, like you talked about in Bowling Green, they're raising the rates every single day. And we're just not able to do that at the pace that they're doing it. You know, they're paying a certified nursing assistant $2 more an hour than we're paying. That's a low-level, hard job. And it's hard to keep somebody here when they think they can go down the road and make $2 more an hour.
The 1,800 healthcare, who all does that include? TJ and all of the nursing home facilities or long-term?
All the nursing home and the home cares that serve Marion County.
Okay.
Assisted living.
No,
No.
that's not.
No,
That
that's-
wasn't
No,
defined.
just home health.
Okay.
agencies.
So if you guys want to task me to put this proposal together for the court Tuesday, I will. But again, I would like to ask these folks to come back. I'm pretty sure that we can probably get another couple of healthcare providers, CFOs to come and speak as well. Along with maybe some nurses, if they can spare them.
Yeah.
You know, so that's totally up to you guys.
And whatever's decided here, just to be clear, once we make, the court makes that decision, then the payroll, you guys will actually run that. And that will be dispersed. Just to be clear.
Not our treasurer.
Not,
Right.
She's gonna have
That's
to-
correct.
Yeah,
yeah,
I
our
think what-
treasurer won't be
I think
involved.
what our
Correct.
CFO said is that
Right.
if she gets the check, she can disperse it between the other facilities and then keep one part of that.
Just want to make that clear because
Yeah,
that was
No,
a point of contention
right.
earlier, so.
We just make sure the county attorney draws it up the way we want it, you know, as an agreement with them two,
Right.
how they have to spend it. And then we move forward with it. So,
I don't think you can go wrong. Your healthcare workers are important people in our county.
correct.
Absolutely.
Thank you for your all's time.
Yeah.
I think probably we'll have some other court members possibly have some questions. If you all could squeeze out just a little bit. I don't know how the judge is going, maybe he can make it to where you all won't have to be here quite as long if we can get that business some way of time frame that you, because if we're gonna bring your all's workers, we don't need to have a big gap. So I don't know, you can make that work.
Tim, do you have any questions? I know
Yes.
you're on. Just want to see if Tim. yeah.
Tim, can you hear me?
One thing I was wondering too is how much they have received already. Yeah. Yes. Can you hear me?
Yes,
Yes, yes.
Can you hear me?
Yes.
we can. We got you.
One question, can I just call you Jeff?
Yes.
One question I had is how much money have they already received and how was that used?
Just, you all just answered that. He must have not heard it.
Yeah.
Yeah.
Did you hear me?
Let me get him. Let me get him over here. Tim.
Can you hear me now?
Yes.
Yes, I couldn't hear. I was just asking how much money, how much actual money they,
Received already, how it was spent. Well, they actually answered that. Did you not hear them answer that about?
It's all mumble, but that's okay. I can ask it Tuesday in court.
Okay, but they did answer that, and the answer,
Answer that about.
I think he needs to answer now.
Yeah.
That way, yeah,
all right, thank you.
he needs that answer now. He needs to be answered now because there's gonna be a lot of talk between now and then. And he needs that answer now.
Yes.
He needs to hear verbatim from these guys.
One thing while he's waiting on there,
I'm gonna let them answer this question, your question now. For the simple fact that I just know there's gonna be one that's gonna try to change this around a little bit. So go ahead and ask that question again.
My question was, how much money you have received thus far and how was that money spent? And also, this go to personnel that's not actually involved hands-on with the patients, or does this go to every employee, including administrators or office people?
Okay, here they are.
Yeah, so the amount of money that we received from the onset, that question would be better answered honestly by our CFO. And I say that because trying to navigate all the funds in which we have been allocated since then would be, it's challenging at best. And we've got it from different sources. And much like this money, whatever source we got it from designated, this is what has to be used for. Whether that's shortfall for budget because we forced you to close your services, whether that's could be used on your rural health clinics in the outlying areas, whether you could use it on staffing. So we've received a variety of different grants since then and allocated it differently based on whatever regulation that was. But we will definitely have, now that's the hospital. What I can't speak for, and I'll probably get a heads up too on the nursing homes, because they also receive money. And I'm not too sure how much or what and how they spent, but the high level question I can answer, which is out of the money we received, is it, and that's the answer I answered earlier, what's the money we've received, is it covered for the losses which we have taken? No, it's not even that close to that. Has it allowed us to stay afloat on our staffing, not been able to go into the significant debt? Yes, it did. It did allow us to do that. And every hospital had that for sure. So, but we will have that spelled out into a more specific numbers based on what we received and where that money's been allocated to Tuesday.
And that's sort of how it worked for county government. The first lump sum that we received on PVP money was for operational. We couldn't use anything for premium pay. It was just lost revenue for operation. Yeah, that was it. But this round here is, what we can do with it for premium pay.
And I can address the question regarding who will receive the money. Administration doesn't have to receive the money. Neil and I don't care. But it is hard to say frontline nursing staff gets it, but the respiratory therapist who goes in there and is taking care of your lungs doesn't get it. Or the patient service rep that greets them at the door when they're COVID positive and have nothing on their face doesn't get it. So it's kind of hard to define between the staff level employees who would get it and who would not, but administration, they don't need it.
Yeah, we can certainly, we will refine that number to who you all feels the best to get that. There's always gonna be that group that's challenging, because again, they work in an outpatient setting, and they just check people in, but I probably had 40 people out cold because they got exposed to it. So are they frontline? For us, they are frontline. So that, but we can certainly refine that number.
Yeah, and as a court, I don't know that we need to be dictating, you know, because you guys need, you know who done what, and, you know, to say this person needs it over this person, well, we don't know what their job duties were. I don't want to get into that.
I
just,
mean, you know, our security guards.
I think Kristen,
May I interject here just a little bit? One of the important guidelines is that first priority needs to be given to lower income employees. And typically the cutoff for that, or the cutoff that the federal government has set, is employees who make $69,000 or less. So just that is what they're going to be looking at. Now, other people qualify for it, but the lower income employees should get first. They should get first priority.
well, there you go.
Yeah, and I can speak for my organization. Administratively, we're not interested. We could certainly roll ourselves out today and have no issue doing that. We'd much rather, we're trying to retain people, and we'll do everything we can, and any help you can provide is fantastic for us, truly. But I would also tell you, I advocate for everybody in the organization, because if you're in healthcare, you've been on the front line, no matter what your role's been, at some level, you've had to work with people and work in this environment, and it's been challenging, to say the least.
I will add one thing. I guess if you feel a little hesitant, it's not that we are, if you kept up with the paper the last 3 weeks or so, we've just come out of a little drama situation in our first payout. We're just trying to make sure this time that we're going a little slower. We realize that the workers do deserve that, hindsight again, but we're just making sure we just go just a little slower. And just, you all read the paper and stuff. We just want to make sure everybody, all the court is listening. We're not going to have any rush decision. And it's not me and the judge or me and Mark is trying to come up with any kind of scam or presentations or trying to do underhanded. We want it to be all together. I wish all court members was, and I was going to mention the judge the next time in the next line item we have, we all, whenever we're here, we all need to just be together and make sure we're all unified. I think that's the best, and they're not all here. I don't know why they couldn't assume, but I don't understand that, but we just don't want to make a mistake again and get the press involved and right or wrong or whatever. And we're just coming out of a healing process. I think we pretty well got united finally on the other. So we want to make sure that we just sharing that we just.
And we certainly appreciate that, because the last thing that we want is for our frontline staff to be in the middle of a squabble in the newspaper. They don't deserve that.
Right.
Well, not also.
Nor do you.
I would also tell you, just everything you've done to this point has been acknowledgement for the judge to come out, have the conversation. You could not give us a dime. My communication back to the team is you all have a large responsibility with a lot of money. Everybody wants a piece of that money. I understand it. And just to consider us in that is acknowledgement that what we do is important. And that's how I will certainly go back and present it to our team, whether you give us a dime or not give us a dime. And I know it's a hard job, and I know it's a lot of money. We've got a lot of people calling, but we appreciate the consideration.
Thank you.
That for us is a lot.
Well, 9 o'clock Tuesday.
Okay.
Try to get you in. Try to get them in first thing.
I think we should. First line
I
item.
may have to offer a premium pay to a nurse to come up here and talk.
Take a break.
Well, thank you all. We certainly appreciate it.
Thank you very much.
Appreciate you.
Thank you.
Appreciate y'all. As far as, this is what our meeting was, is just discuss American Rescue Plan. They were willing to come up. We're just talking. We're not going you know, for everybody that's listening, we're just talking here and, trying to do the right thing. I think we've always tried to do the right thing. And sometimes when you've got 8 here that makes decision, you know, we all think a little different. We all, you know, have different business, different, but I think the ultimate goal here may be able to happen if we just sit and listen coming Tuesday. Judge, Christie, I know you didn't say much. Do you have anything else you need to speak? Because you're the key to what we can do and what we can't do. Krista?
I feel like just need a plan.
Judge, you have anything else?
No, I mean, I'll be ready to make it to make a recommendation Tuesday.
Okay. Well, I think that, in all honesty, would be the best, because I don't want people to think it's our little committee that's trying to do whatever. We're just bringing it up in communication, something started. So we got a game plan for Tuesday. No recommendations other than we were just listening to information, and we'll bring it on and the full court can decide. We got 8 votes here, and if you was to make a presentation, we'll see.
Sounds
What
good.
the 8 wants to do. Thank you all. I'm gonna,
Thank you.
thank you. I'm actually gonna make a motion to adjourn.
Second.